Thank you, sir. Good afternoon, everybody, and welcome to our Tend at the Top chat. As most of you see, we have an agenda, and some of you have been with us before, but just briefly, I just want to talk about that we've been doing this since almost the beginning of the pandemic, just trying to reach out to the presence of where the Tend at the Top is throughout the upstate, and it's been well received. So for those of you who have been with us for a while, thank you for being here. And for those that you have joined us for the first time, I think you're going to join, like many of us, the conversations that we're having across the upstate. Today I get as being chairman of Tend at the Top, I get the honor of presenting our guests at most of these events. And I think we've got a couple of officers here online. I saw David Fields and the incoming chair after me, and Dean and his team. But today we get a chance to listen to a presentation by Sam Kondouris. And Sam is no stranger to us in upstate. He is president and CEO of South Carolina Bio, the biotechnology industry organization, just to the economic impact of what's been happening to us during the pandemic has been tremendous. But as Sam would tell us, that the South Carolina life sciences industry is such a powerful force within our boundaries in our state, and Sam's organization touches virtually all the counties within our state. And so I am looking forward to him talking about some of the things that drive this particular industry, and to see how this particular knowledge-based industry affects our community, and especially the upstate of South Carolina. So without any further ado, I welcome Sam Kondouris to the presentation. Sam?
Great. Thank you so much, Mayor. I'm honored to be here with Tend at the Top today. Thank you, Dean, as well. And great to see a couple of my former colleagues from my Upstate Alliance days, board leaders on this call as well. So yeah, my objective to what you were just saying, Mayor, is hopefully to present some silver linings in what has been, one of the most challenging years in our history, without a doubt. And, actually I come from the automotive industry, and that's a long story on how I got from that to healthcare to life sciences over the last 2 decades. But in a year in which, during the low point of the spring, we saw the auto industry about 44% down based on just global supply chain challenges. Aerospace was actually down over 70%. The life science industry is actually up. And not without challenges. It's been hit with some of the shrapnel of COVID, but this powerful industry that's about $1.5 trillion globally and feeds an $8 trillion global healthcare spend is front and center with healthcare and trying to help navigate us out of this pandemic. So everything from companies in South Carolina that produce COVID-19 PCR tests, to antibody tests, to face shields, to today, the beautiful facility that you see on the screen right now. It's very appropriate that I'm showing that first, because that's where I am. I'm actually using the office right now of our board chair, Lou Kennedy. We have a lot of meetings going on here today, just based on some of the unique opportunities that continue to arise for this industry. But Nephron produces billions of doses of respiratory drugs every year. Many of those are first-line protocol treatments for COVID patients all over the United States. So they are up 134% and have topped 2,000 employees now at this facility. So it's just one of the many, I'm going to say, good stories. And when you look at that stunning facility, 500,000 square feet, and they just announced another $215 million expansion in the last month, and it is already under construction. They're planning on some unique repatriation onshoring strategies in some adjacent buildings that they're also going to be part of, and collaborating with other companies, it does give us hope that this industry can be a big part of the recovery. So I'm going to say next a lot because kindly this presentation, I'm visual, so I'm showing y'all a few screens to help tell the story a little more effectively. So you're just going to hear me say next a few times because somebody else is driving. So next. All right. So, let me take you back 3.5 years. Prior to this, I was heading a research development corporation at Greenville Health System before it became Prisma. And frankly, I was recruited at a time when the life sciences industry was really starting to show some muscle in South Carolina, but to kind of blow up and reinvent SC Bio and help transform it from more of a very solid industry association to being a very high impact economic development organization. And to get on that journey with our Department of Commerce, which is in fact the largest funder of SC Bio, first, that saying goes, in God we trust, everyone else bring data. We needed to understand what we had because it was more of an anecdotal understanding that there were a lot of life science companies, if you look even at the upstate, from Abbott and Pickens County or Lonza and Greenwood County, et cetera, but we just didn't really know what we had. So a third-party study was done, and what it revealed was kind of surprising to everybody from Bobby Hitt on down, because it revealed in a state that had never had a deliberate strategy on how to attract this industry as much as we'd been welcoming to companies like Nephron for as long as we could, was that it had organically grown in South Carolina to be over, you can go ahead and go next, thank you. It had already grown to over $12 billion in annual economic impact. The big surprise, over 600 life science firms in 6 different major subsegments distributed very well across the state of South Carolina. In fact, it's the only industry we can find where 43 out of 46 counties have a life science firm, if you include all of that. Now, the other thing, the prior screen, the image you saw was the front cover of our strategic plan. So probably the single most important thing Commerce asked us to do in our memorandum of understanding to support their funding was create the first ever strategic plan on how do you build, advance, innovate, and grow this very complex industry in a state like South Carolina. And we're now on the 3rd iteration of that strategic plan, and it's got incredible input from a multidisciplinary board of directors, from very talented, a very talented bullpen, I would call it, of our Industry Innovation Council, et cetera. But exciting to see these are actually 3-year-old numbers now, and we know just watching a company like Nephron, when these numbers were first run, they were had just relocated from Florida. We're about 200 positions. They're over 2,000 now. We're well over 50,000 jobs. So we expect that it's probably about a $14 billion annual impact. I think for a lot of people, it's fair to say, what is life sciences? That's just one of those huge terms, kind of like advanced materials. So if you look at the bottom right of the screen, and I'm spending more time on this one than any because it gives you a foundation. So it's broken into the way we do it: drugs and pharmaceuticals, med tech, and every imaginable medical device you can think of. Now the fastest growing segment is digital health, health IT. Think about everything from EMR systems to wearables and software, apps, et cetera. And in a time like COVID, again, I got to say, another one of those silver linings: telemedicine pole vaulted forward probably 10 years in 2 months. So those are some of the good things coming from all of this. A large arena of research, testing, and medical labs, diagnostics companies, many of which are in South Carolina and are starring players right now in terms of providing PCR COVID-19 tests, kits, and processing those, as well as antibody testing, et cetera. But even bioscience distribution is unique because you got to think about, you're in an industry where we all count on whatever drugs we take every day that they are efficacious. And they have to typically be temperature controlled and monitored, whether being shipped from South Carolina to Singapore, and whether it's $1 million vial of an Amgen experimental drug going overseas, or whether it's a tanker ship with the entire flu vaccine for the population of Brazil. So, a Western Hemisphere now headquartered company in Greenville called Softbox. That is actually the largest pharmaceutical packaging company in Europe that could have chosen anywhere in the U.S. to put its Western Hemisphere base, and did choose Greenville. Anyway, it moves all the way to bio-ag, which is one reason a lot of our most rural counties are even involved. Next, please. I'm going to just quickly show you a few shots of some of the leading players. The cool thing is we have so many dynamic startups and early stage life science companies and small to medium size, but it's good to see some of those 800-pound gorilla global iconic brands and how successful they are in South Carolina. So Thermo Fisher Scientific acquired the former Roche facility in Florence County, 1,400-acre campus, 11-story reactors that produce some of the most innovative active pharmaceutical ingredients in the United States. Next. Thorne Research, another relocation story. Arguably the top science-based nutraceutical company with various diagnostics divisions in the country. It was based in Idaho. The owners made a decision that they were going to have to go elsewhere to scale up. They did a 50-state search. They chose Charleston, South Carolina, 350,000 square feet, and a major investment that continues to grow. They're another company. They're actually 200% up right now in sales during COVID because they're all about immunology and immune system strengthening. Next, please. Arthrex, what a great upstate story. So this company is arguably one of the top 2 or 3 in the world in the space of surgical instruments and implants, headquartered in Naples, Florida, where they've invested hundreds of millions, but realized that they needed a new major beachhead to produce a wide portfolio of, you're hearing some thunderstorm activity down in Columbia right now if you just caught that lightning and thunderclap. But Arthrex could have gone anywhere, would have been coveted by any state in the country, and chose Anderson, South Carolina. Good thing, Mayor Roberts, for a lot of reasons, but it includes a deep partnership with Clemson University, but also with MUSC. So while they have plans to innovate, this company at any given time has about 2,000 novel ideas in their pipeline, and they're one of the fastest in the world in going from a novel idea to having it at the bedside of the patient or in the operating suite. So we're very excited to have a company of, this kind of restless engineering quality, kind of a BMW, if you will, of the medical device world. Next, please. And then another great upstate story, Abbott Laboratories. We all knew it as St. Jude for a long time. And the cool thing is, in addition to the constant growth and employing well over 500 individuals, producing pacemakers, defibrillators, actually one of the top innovation teams in the country is the reason with Dr. Tom Strange, who is a prolific inventor in this space. It's why St. Jude bought Dr. Strange's company years ago, and then St. Jude was acquired by Abbott. So Abbott continues to not only produce product used all over the world, they are also a great innovation spot here in South Carolina. Next, please. And then, back to Nephron, and I've kind of told you that story, and it's an amazing one, and continues to grow literally week by week. So we'll continue on. Next, please. Okay, just kind of bring you home real quickly on the core mission areas of SE Bio. So again, bold mission to build, advance, innovate, and grow the life science industry. We got the why with the economic impact report. The strategic plan has laid out the how. We're constantly refining that, but the areas that we really focus heavily in are economic development. I'll talk a little bit more about that. Kind of a 3-pronged attack. First and foremost, let's take care of the 600+ life science companies all across the state of South Carolina and give them as much support, troubleshoot, facilitate, and help them continue to prosper and grow. They have banked their future on South Carolina, and they're counting on us. Next, we are recruiting a new generation of life science companies from all over the world and leveraging the fact that we're #1 in the country in foreign direct investment. Finally, the hardest area, but one that we're getting a lot stronger at, is growing our own life science companies and developing an ecosystem that doesn't just cheerlead these companies, but can actually financially support and nurture them. Being the voice of the industry is key. There is no doubt, while we are much more business and economic development focused, we always try to be there for our industry if there are federal or state policies that could prove to be obstacles or chill the growth or expansion, or just opportunities to make South Carolina much more competitive. So that is an area we work on a lot. And you would expect to see workforce and talent on this. I mean, the fact is, it's such a crazy time that we were under 2% unemployment pre-COVID and now at record unemployment rates. But the fact is, we're still working hard to develop the depth of the talent pool for this industry and still trying to put a lot more infrastructure in place in our technical college system, as well as leveraging the power of our research universities and getting better at it, but still a long way to go. There are other things I'll talk about briefly, how we serve as a global marketing engine, because frankly, most people just don't even know that South Carolina has a real life science story or what that is. And we have come a long way. I used to kind of jokingly say with my humor that, you know, people used to think we were in life sciences a little bit of the valley of humility between the mountains of the Research Triangle Park in North Carolina and Emory and the Center for Disease Control in Atlanta. But let me tell you, we are building our own mountain now. Next, please. So this is just going to be some fast images. This just kind of shows you it's a high impact relational sport. Gratefully, we have terrific relationships with our congressional delegation, as well as with our legislature and our governor's office. I was on a Zoom call yesterday with our lieutenant governor on a new project that has emerged. We will have several of our industry CEOs in the office with Governor McMaster next week, just talking about unique challenges and opportunities of the industry itself. We partner fearlessly with all of our fellow agencies. So you see at the U.S. Capitol standing with the president of the South Carolina Chamber of Commerce, Ted Pitts. And I will tell you, work hand in glove as well with Bob Quinn, who's presidency of the South Carolina Research Authority. And we are jointly working on a competitiveness initiative to make South Carolina much more attractive to states. Next, please. Just because COVID is so important right now, I'm taking a moment just to kind of show that we, like so many other people, use that word pivot. We had to pivot ourselves, and we wanted to try to add value and be a solution provider and battle COVID wherever we could, because none of us have ever been through anything like this. So working together collaboratively, we were able, with the South Carolina Manufacturing Extension Partnership, with the South Carolina Hospital Association, which is on our board of directors as well, and with the Department of Commerce, to rapidly launch an online emergency supplies portal to ensure that every life science company in the state of South Carolina that had a product or a technology, from respiratory therapies to PCR COVID-19 testing to face shields, could be easily brought to bear to meet the needs first of our clinicians and healthcare providers, but now every business in the state has access to this portal. We also launched a South Carolina Life Sciences job board, because in a 1-week period when thousands of healthcare employees at the heart of the situation were furloughed or laid off, we had life science companies like Nephron and Thorne, Vicor Scientific desperately needing more employees. So a lot of different things that we continue to work on to try to battle this pandemic while keeping focused on our core mission areas. Next, please. This is just a neat little graphic. We actually finally counted up how many of the companies in our life science portfolio literally did either a pivot or enhanced or expanded operations to provide new COVID-19 solutions. Over 70, as you can see, and I could spend an hour on those and won't, but I'll tell you what, I'm going to talk about one. You see ZVerse, far left. Many of you may not have heard of ZVerse, Columbia-based company. They are now on our SC Bio board of directors. Incredible 3D imaging company that was challenged by Prisma and others to produce innovative face shields quickly. They realized they could never keep up with demand without scaling up and injection molding and becoming a much larger industry. They are now the largest producer of shields in the country. Millions are being shipped. They have major customers from Kaiser Permanente, the largest healthcare systems in the country, because it's a neck up design. It's very ergonomic. It's actually an attractive product and meets so many needs. Okay, next, please. So continuing with the economic development theme, we are not sitting on our hands with this COVID situation and doing everything we can to be a big part of the recovery that South Carolina will be seeking. So a unique economic development task force has been launched with a pure life science focus, with commerce, with all of our regional alliances, local counties, combined with a competitiveness initiative where we are looking and we're in the process of even crafting legislation that would help our state be more competitive with some of the states that have I'm going to still say, a more tailored, more customized approach to the things that this industry needs when it has to invest millions of dollars in FDA, clinical trials, et cetera, to take product to market. The big focus, though, is repatriation and onshoring, bringing so many, bottom line, we as Americans realized on a global supply chain basis during this crisis that over 90% of all the drugs we take, medical devices we use, and PPE are produced overseas. We never want to be that vulnerable again. So let's just say there are a lot of strategies now focused on how to incentivize repatriation and onshoring here. Next, please. This is again flexing some muscles that we've been good at. It's incredible to see all those international companies, and it's been a thing that South Carolina has been good at and proud of for quite a long time. Over 40 companies represented. Something that we try to do at SC Bio to really assist our partners in economic development at the state, regional, and local level is add a lot of new muscle to the international landing pad strategy. And that is basically saying these companies need more than just good traditional incentives and site information or buildings. They need help with FDA navigation. They need help with reimbursement strategies, how to get their products and services reimbursed by private payers, by CMS. They need to know how can we actually get introduced to your large healthcare systems who might do a pilot with us, validation, might even be an early adopter of a new technology that's cutting edge. How do we get to know those bioengineers from Clemson or a neurosurgeon from MUSC? It's unique needs this industry has. So as much as pure economic development, what we're constantly working on is build an ecosystem that can bring everything to bear that this industry needs in the state of South Carolina. Good news is I'm going to tell you, we got all the ingredients for success. Next, please. And part of it is even having physical destinations. We are literally working on a number of greenfield projects right now that would be standalone facilities, but there are facilities popping up all around the upstate as well as other parts of South Carolina that are designed specifically to meet needs of life science companies with wet labs and, again, unique infrastructure to this industry. Next, please. Lastly, on the economic development side, I just want to take a moment to, kind of soft announce, we are launching a new innovation platform on how to move novel concepts that can enhance the delivery of healthcare, ease pain, much more rapidly to the marketplace with South Carolina companies that have those great novel ideas. We're teaming up with some amazing partners, some of them out of state, some of them in state, but stay tuned. This in tandem and complementary to say what SCRA and others do is going to make us more forceful in growing our own companies. Next, please. And it goes without saying, this industry demands talent, needs talent, and we will never achieve our vision for the life science industry in South Carolina without deeply integrated relationships with all of our research universities, with all of our institutions of higher learning, and then unique research centers like Greenwood Genetics, which is such a global jewel right there in the upstate in Greenwood County. We have a lot of workforce initiatives that run the gamut from K through 12 to developing new biotech and medtech curriculums in our technical college system with their support, and then bringing the muscle of the research universities to these industries. Next, please. Very quickly, I talked earlier that the lowest hanging fruit is telling our story. What we have found is that if we are willing to get out there like we have and outwork a lot of other states, and so we go to Arab Health and the Swiss Biotech Conference and Medica in Dusseldorf, Germany, and targeted marketing trips to places like Italy. Our job in direct partnership with the Commerce Department, our major regions, and even some of our counties is do an excellent job of talking about this ecosystem that exists in South Carolina that most people assume that was in North Carolina, and we're like, nope, you need to look south. we've got it too. And I think we work a little harder. So this is a big part of how we support our economic development partners. Next, please. And this just gives you a quick snapshot. You know, what a strange year for COVID-19. I'll have to say, I don't miss all the airplanes right now. And it'll be probably a while before we really get back into meeting in person, overseas, what have you. But that is normally a huge part of how we spend our time. Fact is, we're still doing it very successfully on a virtual basis by Zoom. But I'll tell you right now, we have an international group in the state right now that we are meeting in person, because sometimes there is no substitute. So we're all masked up and being very careful in social distancing and making it happen. Next, please. And then finally, I'll re-emphasize, we got an exceptional team, and two of our newest employees are graduates of Clemson University, an incredible genetics major who's our investor relations manager, an incredible bioengineer who is our technology and innovation manager, and then our senior intern, also a bioengineer. So again, just to tap into the South Carolina talent and be part of creating opportunities for our students where they don't need to leave, because one of the biggest problems with this industry in particular is there just weren't enough opportunities for the talent that we were graduating, and so many left the state, and people want to be in this state now. So we're excited about that. But this is not a natural phenomenon. We're having to put a lot of very deliberate work, and it's thrusting a lot of industry leaders in the room with a lot of educators to make sure they're in full alignment on how they do this. Next, please. And it's all about collaboration as I move toward a close. We are the official state affiliate of major national bio organizations, Biotechnology Innovation Organization, Pharma, AdvaMed, which would be the largest med tech organization. We are on the board of directors of what is now the Southeast Life Science Alliance, an 8-state consortium. And, you know, in addition to all of our important partnerships throughout the state. So we're able to bring some muscle to bear when we need to, and we get a lot of support from these national organizations who are frankly really excited to see the energy and the entrepreneurship of South Carolina as really becoming one of the fastest rising states in this space. Next, please. And that leads to other things, biobusiness solutions. These are some of the unique programs. By having powerful national partners, we're able to help the bottom line of many of our own companies. And it's just one of many of the benefits for our members that we try to put front and center to help them be profitable so they can give back and keep moving. Next, please. This is just a tribute to we humbly, because the message and the vision and the timing is right, have quadrupled revenue in 3 years. Without all of those investors you see listed at multiple levels, that would be impossible. And Upstate Alliance, for example, is one of our strong board members, and so many upstate companies, Prisma on our board of directors, et cetera. So just know we do need fuel in the tank. And, you know, to give you the comparison, while we're ahead of some states in funding a strategy, is you just can't do this for free and you need resources. While we are very appreciative of funding that we get from the Commerce Department at around $100,000 a year, what have you, the benchmark would be this. In North Carolina, the legislature provides to our counterpart organization $13.6 million a year. That's a lot to compete with. So we're going to continue trying to tell this story and get more and more people to be part of the Army to help us build this industry. Next, please. Okay, and I'm going to wrap up, other than here's a couple images of our board of directors. The last thing I could say is just great multidisciplinary talented folks that run the gamut from healthcare to core industry to economic development partners to academia to core service providers, and it's an amazing group of talent from all over the state. If you'll flip again, you'll see one more screen of our board. Next, please. And then just our team. So we have 6 people who get out of bed every day now that are committed to how to build, advance, grow the industry. And so it's agile, it's stealthy, they're hardworking, but call on us at any time. That's the bottom line. You know, I'm CEO and chief bottle washer. It's whatever it takes, and we're there for you. Next, please. Lastly, I'll just mention typically in a non-COVID year, we average over 50 gatherings a year, whether it's a legislative reception, a boot camp, a corporate meet and greet. But our annual conference, which is between 400 and 500 people normally, very high impact event, we have shifted it out of the fall this year, and it will be February 16 to 18 in Charleston, with the hope, we're still planning to try to hopefully do that in person, but please stay tuned to that and be part of it, whether it's virtual or live. And with that, I'm wrapped up, Dean, and sorry if I took a little too much time, but love any questions you might want to fire my way.
No, great, Sam. Very good information, and it's just, really amazing to see how this sector here in the upstate has taken off really at what has turned out to be a very appropriate and opportune time, I think, for the state in the bioscience industry. I have a quick question. I mean, it's really amazing the number you gave of the 71 companies that pivoted and have done something related to supporting COVID from here in South Carolina. My question is, what is the expectation, or do you know how many of those companies do you foresee that being a long-term now component of their business?
Right. No, it's a great question. And there's no doubt we have a couple of companies that pivoted temporarily for survival reasons, they knew they had the capability to produce, incredibly needed PPE. But we've had others. That's the reason I kind of highlighted Z-Verse. They're a good example. While they will continue to be a world-class 3D imaging company that integrates CAD systems and they can support any industry, including life sciences, when they made that shift to face shields and then scaled up on a permanent basis to be able to produce millions of them and combine that with their creativity of a very innovative design, they have become, the #1 go-to face shield in America for whether it's educators, industry folks, and beyond. And I think in the same way, whether we like it or not, that 9/11 type events, Great Recession, we were never quite the same after some of these seismic things that occur in our country. There's no doubt COVID is going to change us in some ways forever. And so I do think a lot of the pivots will be permanent, but part of a larger portfolio, if you will. Another, great upstate pivot example would be Milwaukee. Huge lack of swabs needed for COVID-19 test kits. And they have a very innovative solution. And there's no doubt in my mind that that'll be part of this desire that all of those came from China and other places in the past. And we don't want it to be that way going forward. So I think for a number of reasons, many of the pivots will be permanent.
Great. And we have a question from Liz Seaman at Furman, asks, can you talk a little more about the talent retention and recruitment in life sciences and how you're working with, and a personal plug with Furman and the other schools in that effort?
Thanks, Liz. And Furman's a great example. When we kind of relaunched SE Bio 3.5 years ago, we were grateful that MUSC, USC, and Clemson were on our board, and SIMT, representing the Florence Darlington Technical College system, which has very unique capabilities down there, by the way, was our first technical college on board. It has grown exponentially since, and one of our most exciting new investor board members this year was Furman University, and they are doing such unique things in the innovation space. And Furman has been very committed to population health strategies, working with Prisma and other entities like that, Liz. So, it's been exciting for us to work with y'all. Again, what we realized when we did that first strategic plan was our greatest opportunity and definitely our greatest challenge, not to sound trite, is workforce. So you can imagine pre-COVID with under 2% unemployment and the tightness of the labor market at that time, and then life sciences being the industry least understood, frankly, in comparison with automotive or aerospace, and not having yet the certification programs and course offerings and degrees, whether in technical college, and us not necessarily being as connected between the industry and the universities like Furman to tap that talent and to really display this incredible swath of careers. I mean, we need great business people. We need great marketers in this industry. It is not nearly as niched as people think. So it's a short, mid, long-term strategy, and we have people dedicated to K through 12, community technical college systems, and then our 4-year universities and research universities. And again, we find the real key is putting industry in the room with educators, a lot like we Clemson did with ICAR years ago, where ensuring that relevance of the curriculum was going to meet the needs of industry later.
Great, thank you, Sam. And we had a question about K-12, and you touched on it briefly. If you could put that in the chat, maybe back to Terry, we'd appreciate that. And thanks again for your time and being with us today.
Hey, it was a lot of fun. Thank you.
Good. And we will have Sam's presentation on the summary page for this TATT chat along with the recording. So if you want to see anything more, you can check it out there. So again, thanks Sam, and great news and a lot of good things going on in the industry. So great to hear.
Dean, thanks for what y'all do as well. It's a great mission, and thank you for letting us be part of the day today. Please, all of you that were kind enough to listen in, don't hesitate to reach out to us. Our website's real easy, scbio.org, and you'll find it's not hard to find us. Thanks.
Great. Well, Terrence, I'm going to just keep moving on, and we've got a couple quick polling questions I'm going to ask. We try to do this to just kind of get a sense of what the feeling is in the room and what people are doing. A couple of interesting questions today. The first one, did you go out of town for vacation this summer? And then the second one, and I know no one is doing this now, do you multitask when attending online meetings? And if anyone answers no, then then you're much better than most of the rest of us. I wanted to have yes, except when I'm on the TATT chat, but that didn't quite make it on there. So we'll give a few more seconds. We've got a lot of folks coming in. And if for those who were able to go on a vacation this summer, which looks like maybe a little bit less than 50%, if you want to share where you went or all the fun that you had, that those of us who didn't get the opportunity to go on vacation can be envious of, you're certainly welcome to do that. But I'm going to share the results here. So the number one for did you go out of town, 46% said yes, and 54% no. So probably not a big surprise in terms of folks feeling comfortable and not with going out on vacation. And then the multitasking, notice no one said 100% focus. So at least we have no absolute liars in this room. It depends on the meeting. I hope that means, again, for meetings except for TATT chats. So just kind of fun. I know everybody has been on a lot of these Zoom chats, and it certainly has its great positives, but it also has its challenges. With that, I'm going to mention our next TATT chat on the 27th of August will be with Sean Dogan, who is the interim executive director for the Urban League of the Upstate. So we hope you will join us for that. And a few of you joined me for a few minutes to chat before this, but we're going to start. We feel like one of the things that all of us are missing is, you come to a meeting a few minutes early and catch in with your friends and things like that. And we've really missed that over the last several months. So we're going to open the lines in one of the breakout rooms 20 minutes early, beginning when we started today for TATT chat. So if you want to join us a little bit early in the future for these meetings, we can catch up a little bit before we actually start the meeting. So with that, I'm going to turn it over to Justine. If you'll real quickly talk about peak, and then we'll turn it over to Sharon for the county updates.
Okay, thank you. Hi, everyone. Our peak event for young professionals, we decided to move that to the spring and not try to do that online. But Dean had a great idea, which is creating a series of events called Sneak Peek. So we are doing a monthly virtual hour-long event online. And again, that's for young professionals. The first one is going to be Trivia Happy Hour on September 14th. It's going to be super fun, and then we'll announce each time what we'll be doing the month following that. We also have our Entrepreneur Ecosystem group coming up on September 26th.
August.
I'm sorry, did I say September?
Yeah.
Thank you. August 26th. And funny that Sam was online talking about biotech, because we will be hearing from Paul Clark. He's with Venture South Carolina, and he's going to be sharing an app/platform called Sharpen Founder that they're making open and free to all entrepreneurs in the state, that is dedicated to helping out with mental health and primarily promoting resiliency in your life and in your business. And then finally, we have our Senior Issues group, August 27th, and we'll be hearing from AARP South Carolina. Their Associate State Director of Outreach will be talking to us about what's going on with seniors during COVID and kind of the impact and the state of things, and then what they'll be working on going forward, and talking about the fact that Greenville is going to be an area of presence for the AARP.
Great. And Sharon, we'll turn it over to you to do the county updates.
Alrighty. First up from Abbeville County, Shannon Sears is going to give us an update, and they apparently have some pretty exciting things going on. So Shannon, why don't you tell us about it?
Yeah, well, I don't know about too exciting, but I was supposed to give the report, and I'm pinch hitting for him, but I'll tell you some of the things that we have going on. And like most places or most areas, the big talk is school and school starting. And our school starts back on Monday here, and it looks like we're going to have about 30% of the students that will be participating in ITech. So, you know, that's pretty interesting. Of course, I'm from West Carolina, and we provide a fiber network in this area. So part of the talk is us being able to, you know, provide internet service to students that want to school or participate in ITech that are from low-income families and things like that. So we've been working with ORS to get you know, to get some internet to those customers. Also, there's some CARES funding that's coming down from the state, all across the state, for broadband providers to be able to provide high-speed internet to underserved areas. And so that's big news for South Carolina, I think, to be able to expand our network to provide high-speed internet to areas that are underserved or have very low internet speeds today. With people working from home and schooling from home, it's a big part of, you know, of what's going on in our state. And of course, we just heard talking about telemedicine and things like that being big. It gives a great opportunity for people from their home to have a reliable network to do that. So those are the things that we have going on in Abbeville. Hope everybody's doing well.
Thanks for filling in there, Shannon. We're going to have somebody from the city of Abbeville talk about the Opera House, and we'll get him on another time. Next up from Cherokee County, we've got Drake Scott, who is with the Downtown Gaffney organization, and he's going to tell us what's going on with them.
Yeah, thanks, Sharon. Can everybody hear me?
Mm-hmm.
Okay, good. So my name is Drake Scott. As Sharon said, I'm the Main Street Director for the city of Gaffney. I've been in this role here just about 10 months now, so I don't claim to be an expert on everything here, but I am learning. First of all, thank you guys for having us and bringing Cherokee County into this. We really appreciate it. Downtown Gaffney is very much experiencing the same thing that most small towns are right now, and COVID has negatively impacted most of that. However, there are a few things that we are proud of that we're pushing forward with. One is our business generator here in downtown Gaffney, which is actually where my office is. That is called Begin, and that business generator is put on by No2, which is an educational initiative here in Cherokee County. Currently, we have 8 residents in our business generator. They range from personal trainers to videographers. We have home renovation specialists. We have a lady teaching voice lessons. We have right now, we just started this month, a bakery that is fully operational, and she is doing very well. And this month, we actually get to celebrate our first success story out of Begin. And they are moving, it's called Zachary's Coffee Shop, and they are moving out and graduating from Begin and have moved to a building here in downtown Gaffney and are expected to be moving this weekend. So we're very excited about that. We also have, we got an ARC grant for the back of this building to do renovations. So we're also kicking those off right now. Those are beginning here soon. So basically we're going to take a bunch of warehouse space that was in the back and convert it into more offices. So we're very excited about that, being able to accommodate more residents. That's about all the main things we have going on right now, and trying to stay positive with COVID-19, same as everyone else. But thank you guys for including Cherokee County. We look forward to many more.
Thanks, Drake. That's good news about that. Somebody graduating from there. That's
Thank you.
have to take a trip up to Gaffney. And
Yeah,
get some
come on by, get some coffee.
All right, next up from Greenwood, we have Art Bush, who is the interim executive director of the Greenwood Partnership Alliance. And Art, thank you. There you are.
Joined the Partnership Alliance about 6 weeks ago, and all of this came about because of a transition that's going on in Greenwood County. In May, the county council voted to leave the Partnership Alliance and take industrial development with it. So we've been re-examining our mission and decided that our mission is pretty much what it has been. We're going to continue with a lot of the activities we had going on: workforce development, public transportation, housing, city center development, also a lot of work with the Greenwood Genetics Center. And on that note, we just launched a new web page for the Genetics Center today. And I'd encourage all of you to take a look at it. It's really impressive. Also, we're going to be doing an ad in the South Carolina Business Journal to magazine for the Partnership Alliance. And I think the timing is, for the Genetics Center, and I think the timing is really good with the talk that we had that Sam gave us. There's going to be a lot of activity in the biosciences, and we want to be a part of that. The other thing we're getting ready to do a drone project with the 5 industrial sites that we still represent, 4 of which are privately owned, and the other we're doing in connection with the county on the North Greenville Industrial Park. That's pretty much what's going on. Appreciate it. Appreciate the opportunity to get involved, and hope to see all the rest of you again next time. Thank you.
Thank you, Art. That's pretty good timing there to have you talking about the new launch of the Greenwood Genetics Center there with Sam being on today. Next, from Spartanburg, we have B. Smith from the Spartanburg Community College Foundation, and she's going to tell us what they've got going on.
Thank you, Sharon. I appreciate that. We've got a lot going on here at SCC, and we are open for business. We returned to work on June 1st, and we really never stopped. We immediately transitioned to distance ed classes, to virtual classes. Our faculty and staff and students made that transition very well in the spring and have continued throughout the summer. Our longtime president, Henry Giles, retired after 50 plus years of service this summer. Can't believe it. It's unbelievable. Very happy for President Giles, but we also welcomed our new president, Dr. Michael Makota. I hope that you all will have an opportunity to meet him either virtually or in person. He is a dynamic young man that is most recently has been the president at Central Carolina Technical College in Sumter. He is an upstate, he is born and bred here in the upstate. He is originally from Gaffney and graduated from Wofford, his master's degree from Garner-Webb, and his PhD from Clemson. So he's one smart cookie. But I'm looking forward to y'all meeting him. I've had an opportunity to be with Dr. McCuddy. He's now only been here a month, but he has hit the ground running. And he is very supportive of the college and the technical system, as well as our foundation. The SCC Foundation has never stopped as well. We immediately reached out to our students to make them aware and heighten their awareness about our emergency funds and our book funds that we have in place. Keeping people in school and helping them with their education is what we are all about. And as we are continuing to enroll students, as just like others, school starts for us on Monday. We will have face-to-face, hybrid, and online classes. So the foundation, the Spartanburg Community College Foundation, plays a pivotal part in the educational journey of our students, as well as the communities we serve. As you may know, SCC has a 3-county area. We represent Cherokee, Union, and Spartanburg. So our 5 campuses, we are full and fun and open for business. So thank you, Sharon. Thanks, Dean, for including me.
Thanks, B. B, your fundraising dinner, the foundation fundraising dinner, was actually the last event I went to before.
It was the last public event.
You guys squeaked it out there.
We did. As a matter of fact, our flags are still hanging at the Marriott.
Oh, wow. It just didn't take them down. Last but certainly not least, from Union County, we have Curtis Hunter, who her job is in tourism, but she has been wearing a lot of hats and has been staying really busy. And so we appreciate her taking the time to join us today. Curtis, I'm going to unmute you. Nope, I can't. There you go.
Hi, everybody. You're right. We are very busy being from one end of the spectrum to the other, but I can share with you one of the projects that my colleagues, Catherine Pendergrass, I think she has did this in the past for us. We have been working on completing our comprehensive plan for the county, and hopefully we're getting close to the end of presentation, and hopefully it will be adopted before the year's end. A lot of work has gone, hours and hours and hours of going through that. So this week has been really for she and I and our colleague from the COG. We have formed a recreation and event task force here. Our county supervisor, Frank Hart, formed that to help our citizens, because we have a lot of people who have had events and on a yearly basis, and they needed guidance as far as the CDC, the governor's orders. So we have a task force who's working with people to try to keep them in compliance with what they can and cannot do to keep people safe on that end. Also, we have a private developer, and I don't know that I ever mentioned this to Dean or you, Sharon, but he's actually created a western town down on the Catholic River. And hopefully next year, it's called Wildwood Ranch. You can Google it and there are pictures. Hopefully by the time COVID is gone, we will be up and functioning. Beautiful facility, and we're working with him as well to get that up and running. And the last thing I want to say, but not the least, we're losing a star. Rita Drinkwine is moving on, and I'm sure she probably have already told you guys. So we're missing her already.
Thank you, Curtis. Yeah, we were sad to hear about Rita leaving. I know she's brought a lot of energy to your community, and
I'm gonna miss her.
Yeah, she's not leaving the upstate, thankfully.
Right. She's only a phone call away, she says.
Yep. I've already got her in my phone.
Yeah.
Dean wanted me to mention that the comprehensive plan that y'all are working on was part of came about following the comprehensive plan review we did in 2015. And we are currently, we have just hired an intern to review that, to update that review again. So that'll be ongoing this fall, right, Dean?
Yeah.
Through the fall.
So we'll be able to include Union's comprehensive plan along with the other counties this time. So very exciting and great news, Curtis.
Absolutely.
Yep. All right, back to you, Terrence, to close us out.
Thank you, Sharon. Thank you for all of you who attended this chat. I want to again publicly thank Sam and his update of South Carolina Bio. There are a lot of good things going in that industry, and to have almost 43 of our 46 counties involved in some aspect of that map was powerful. Thank you again to Dean and his team for all the updates. You continue to do a great job. And finally, thanks to the county updates. It's always very interesting to see what's happening in other areas of the upstate. So we hope to see you at the next chat, and I hope everybody Don't work tomorrow. Have a good weekend, and we'll see you on the flip side. Have a good day.
Thanks.
Thank you, everybody.